Hi, this is Matt Kuntz. I'm the executive director at NAMI Montana, and just want to give a little bit of groundwork for why we are advocating for open label psychedelic studies for veterans at the Department of Veterans Affairs. Um, so, last year, the MDMA trials were shot down by the FDA, and this was a huge blow to a lot of veterans that are really excited about the research in MDMA and other psychedelics. There had been some movement in Congress to fund some basic studies, but having the FDA said no really changed the feel and the reality of when access to these kind of medications would be, and rightly so. Um, from everything that was said, the challenges were that they didn't know if there really was a way to test the placebo in MDMA. Now, not surprising, probably you should guess whether you got it or not right away. And the second one was there was some real challenging issues with clinical trial management that was just a company issue. But the big thing is for veterans, for the people that love them, placebo is a scientific question that the scientific community, the FDA, needs to resolve. Clinical trial management, that's an issue for that company. So what does it mean for veterans that are desperate to access high level, safe psychedelic care in the United States? And it wasn't good. So what we came up with was, how do you make sure that there is a way to access research grade psychedelic care in the United States so veterans do not have to go overseas, and that there is more access to it? And what we came up with was funding open label psychedelic studies at the VA. So open label, there's no even pretending that they're using a placebo. Really, everybody that is in the trial gets the active psychedelic treatment, and we see whether or not it works. Leave it up to the scientists to figure out placebo effect and all of these different things, but veterans will be able to access high quality, safe psychedelic studies. And then we'll leave up to the scientists and the pharmaceutical companies or whoever else to figure out where to go with the FDA side of it. But these open label studies will be there for access and help, if it's working, help people rebuild their life. And if it's not working, if those open label studies are unsuccessful, that's going to be super important too. So either way, this is the next step for figuring out where to go with psychedelic research for veterans and access in the United States. And we've been working really hard with this in Congress for the last 6 months, and we're hoping that we'll be able to have an update soon. Thank you.